Right, hi there, I am Duncan Scobie. I'm a registered osteopath and currently in lockdown. I had someone yesterday, a patient, asked me about doing things to help their necks, any exercises to help their neck, because they were getting headaches. A large number of headaches are caused by the neck. They are what we call cervicogenic. Whilst people worry about brain tumours and all the sinister things, the vast majority is just due to muscle tightness and that kind of thing, bit of wear and tear in the neck. And also a common sort of misconception is people tend to want to have strengthening exercises for everything. They think that's going to cure every musculoskeletal problem. But really, flexibility and looseness and good quality tissue is really the key to happy tissue and therefore a reduction in symptoms. So I'm going to show you some gentle stretching techniques for the neck. The neck is an incredibly delicate structure in many ways, and if you have a particular medical history or particular medications, for instance steroids, if you're on steroids for anything, for asthma or various acute conditions they might give you steroids for. If you're a bodybuilder and you wrongly take steroids for that, then you have to be extremely careful with anything to do with the neck. I would also advise people against any heavy-handed manipulation to the neck unless you are very confident in the person who's doing it, and because there are issues and dangers with neck manipulation. I do see some horrifying things on YouTube where people are using towels and things to yank on necks, and that is very bad. Okay, right, so this is my wife's modelling. This is our bedroom because of lockdown and not at work. Okay, so with the neck, the most sensitive part as far as delicate and prone to injury, serious injury, is right at the very top. There's a complex structure in there with a ligament holding this pega bone in place, and if that ligament goes, and I have treated people who've had treatment elsewhere and that ligament has been snapped by the practitioner, it is an awful condition to have, so you've got to be very careful. So one thing to help, if you've got to get a friend to help you with this, your partner to help you with this, or a child in your family if possible, one hand on top to stabilise the head, and then you use your first and second fingers there, thumb as a finger, and you just gently press into the base of the skull, where the skull meets the neck, and you just gentle pressure from your two fingertips, and use your left hand just to gently articulate like that and rotate that around. The patient can give you feedback as to whether that feels good or not. So just do that for a few minutes. Nothing, don't go digging in, it's just gentle pressure. What happens is the body sort of gets used to certain tensions of tissue, and if it's in pain, that tissue is far too tight and it gets used to being tight, and just gently loosening it, stretching it, wobbling it like that, it goes, oh, actually I can do this, this is all right, and it relaxes the background tone. It's called gamma gain system, and that helps to release it. So that's all you need to do with that. And then another very simple technique, if you lie down on your back, please raise your head up this end. So you've got to, the person doing this has to be very careful of their own back as well, because normally you know further down that way so your head's not hanging over the edge. Okay, drop down. And then with this one, what I'm going to do is I'm going to have my hands like that, fingertips up, and I'm just going to have my fingertips where the skull again meets the top of the neck. It's called the occipital region. Okay, so you slide your fingers down the skull until it meets the neck, and then you just gently press in, just very gentle pressure, nothing strong. And in fact, you don't almost need to do any pressure. If you just hold your fingers there firmly, the weight of the head itself, if the person lying down is nice and relaxed, the weight itself will press down into the muscle, and after a minute or two will relax. Whilst in this position, you can do very gentle traction as well. So again, the fingertips just where the base of the skull meets the neck, and you just pull in a straight line like that. But it's only millimeters, it's not far. You have to sense yourself what sort of tension there is, and the person lying down can tell you how it feels, if it's uncomfortable, if it's too weak. Between the two of you, you can work it out. Obviously, I've had 30 years of doing this and 4 years training prior to that, 34 years of learning the different sort of feelings and sensations and what to expect with this. So you're going a bit blind, so do it all gently and work with feedback. Feedback from your fingers, feedback from the person lying there, and just be careful, be gentle, okay? You can also just do gentle rocking. You can just take the head to one side and the other side, looking after your own back as well, moving your whole body so your own back is protected. And yeah, so I would just recommend those few gentle things. Waving your neck around. I don't tend to give neck exercises per se, because I think there's quite a high risk of stirring it up anyway yourself. There are lymph nodes in there. There's lots of delicate structures, arteries, large arteries and things. So be very gentle, be very careful. Any questions, you're very welcome to ask me, or you can ask your nearest osteopath. If you like, I'm sure they'll be happy to help. Okay, thank you for watching.